Meet our patients, hear their stories in their very own words. These are patient profiles with Summit Medical Group.
I'm an MRI and I love what I do. I've been affiliated with the group probably 25 to 30 years. I've been a patient here 22 years at Summit Medical Group. I was pregnant with my daughter and I needed an OBGYN, and I worked at Overlook at the time. And I asked some of the nurses, who do you think is the best? And they told me Dr. Heffernan. And she's been my doctor ever since. I'm a person who has my mammogram every year, and I'm very religious about, if it's February, I think it was February, I'd have my mammograms every year, and they were all negative. In fact, the radiologist in February, I was diagnosed in September, came to me personally to tell me everything was fine. And we went back and looked at all those films after I was diagnosed, and nothing showed. I tend to be in that, there's a 10% amount of women that their breast cancers don't image. So that's why I tell my friends now, not only get your mammogram, but you got to listen to your body. I noticed this burning pain in my right breast that I never had before. It was a stabbing, burning pain. And the first time I kind of said, okay, well, you know, things can happen. But when it happened a second time, my husband looked at me and I looked at him and I said, I'm going to call Carol Boyer, who's the breast navigator at Summit Medical Group, first thing Monday morning. So 9 o'clock when the phone's open, I called, got her right away. And her being a breast navigator, she had direct contact with Dr. Cunningham in his office, so they were able to get me in right away, 2 o'clock that afternoon. We sat and figured out how quickly I could get into all the different departments, from nuclear medicine, CAT scanning, MRI. So they were all very accommodating. They got me right in for each of those tests. Within 3 days I had everything done. And I saw the plastic surgeon, Dr. Hyens, met with him and discussed how we wanted to proceed, and we picked a surgery date within 3 days. With my children, we didn't sugarcoat anything. You know, we told them I had cancer, and but we also told them that my prognosis was very good. It wasn't the same as my friend who had had a very difficult cancer. And we needed to get my surgery and do whatever it took. And after meeting with Dr. Wax, my oncologist, we found out that I would need chemo and I would need radiation. I'm celebrating because after 10 long months, 4 surgeries, chemo, radiation, I am done. Today is my done day. Today was my last radiation therapy treatment.
We hope you've enjoyed Patient Profiles with Summit Medical Group. Are you a Summit Medical Group patient with a story to share? We'd like to hear from you. Summit Medical Group is here to help you live well and stay well.